It's one thing to try to remove a contact lens that's stuck in the eye, but what do you do if it's moved off or maybe torn to pieces and it's hiding out and you don't have a slit lamp? I'm Dr. Alana Jasper Trotter. I'm a board certified ophthalmologist, and in this video, I'm going to be breaking down 7 tips to help you find and remove a contact lens. So let's go. Before you get started in trying to remove the contact lens, one of the most important things is to calm the patient down. This has likely turned into just a horrible day for the patient. They probably didn't even expect to see you today. Maybe this is an urgent add-on, or you're seeing this patient in the emergency department, and it sucks, right? I could be bloodshot, irritated. Maybe they've been spending the last 4 hours trying to get this contact lens out. So it's tough, it's overwhelming. Calm the patient down. Let them know that there's a good chance that the contact lens will eventually work its way out. And this leads me to tip number 1. Have the patient blink multiple times in a row while you're doing something else. Walking in, logging into the EMR, you're washing your hands, putting your gloves on, etc. Go ahead and start the process while you're doing something else, because you may get lucky. Them just blinking multiple times in a row may burst the contact lens. Also help calm the patient down and give them some reassurance is to let them know that the contact lens cannot literally go behind the eye. It doesn't have like a trajectory to the brain. And this is because anatomy. The conjunctiva is a thin mucous membrane that lines the anterior aspect of the eye, and then it wraps around to line the posterior side of the upper lid as well as the lower lid. So the contact lens is supposed to be sitting comfortably on the cornea, but let's say it gets dislodged and goes superiorly. I can feel like the contact lens went behind the eye, but because of this cul-de-sac called the fornix, you have a superior fornix as well as an inferior fornix, there's actually a dead end. So there's only so far that the contact lens can go, even though it feels like it went behind the eye, it actually didn't. Number 2 is instill a few drops of lubricating eye drops. So specifically over-the-counter, preservative-free, artificial tear eye drops. That's a lot to say. But why is this helpful? Well, oftentimes a contact lens can be hard to remove if it's suctioned to the eye. So it can happen if the eye is dry. So let's say a patient was wearing a contact lens longer than they should, or maybe they slept in their contacts, and the eye can get dry over time, and so the contact lens can be suctioned onto the eye. It can be harder to remove the contact lens. So putting some lubricating drops, that can help break up that suction. So rather than it being so tight, there's a lubrication between the contact lens and the eye, so then it's easier to remove. Now, let's say you're in a situation where you don't have access to preservative-free artificial tear eye drops. Well, you can also get sterile saline. At EDs, hospitals, you can get sterile saline, pull it up in, let's say, a 5cc syringe, and just flush the eye. Also, if there's like the little sterile saline things, you can also use those as well. Tip number 3 is to have the patient look in the opposite direction from where they feel the contact lens is. The superior fornix is generally larger than the inferior fornix. So if the contact lens gets dislodged or if it tears in half, chances are that it may move superiorly. So by having the patient look in the opposite direction, or inferiorly in this case, and everting the lid, it may bring the contact lens into view, so it could be easier for you to remove the contact lens. All right, so let's move on to tip number 4. This one I think has a little magic to it. So I wear contact lenses, and I have definitely experienced where the contact lens somehow flew off my eye, okay, and it is not where it's supposed to be. And I've done this tip, and oftentimes it works. I'm gonna call it the magnet eye tip. So have the patient close their eyes, and let's say the contact lens got dislodged and moved superiorly. Have the patient look up and down towards where they think the contact lens is. Imagine the eye is a magnet and its friend went superiorly, and every time the eye is moving up, it's fishing that contact lens out, and eventually the hope is that it'll bring the contact lens out. If the magnet eye tip didn't help, let's try tip number 5. So have the patient close their eye, and then using a finger, have the patient massage the contact lens out. So if the contact lens is superiorly, have them massage down to try to push that contact lens out. If it's inferiorly, have them massage up. Tip number 6. Now, this is a tip that I would not jump to as number 1, okay, because you're going to sacrifice the contact lens. Although Really, at this point, they're coming to see you, they're having this issue, that contact lens goes in the garbage once you get it. You can use the sodium fluorescein stain to try to help you identify the contact lens. The sodium fluorescein stain is a temporary eye stain often used in diagnosing a corneal abrasion. Why it's helpful in this case is because that orange color, when it's placed on the eye, it's gonna dye the contact lens neon green. Now, it's not gonna be like just jumping out at you glow in the dark, but it can make the contact lens more visible. You know, especially if the contact lens is just suctioned to the eye, it can be hard to see that, especially without a slit lamp if you don't have magnification. But if you put the sodium fluorescein on the eye and then you start to see a neon green circle, bingo. Tip number 7 is to flush the eye with sterile saline. Now, with a lot of irrigation, it could be difficult to see if the contact lens actually came out, and that's where it can be helpful to have the patient's symptoms to help guide you, like, you fixed me. Now, after irrigating with a bunch of sterile saline, you can have the patient blink multiple times in a row to see if that can also help birth the contact lens. I think I said that twice now. If you see the contact lens and it's in one of the corners of the eye, still kind of hidden, but it's visible, you can put a numbing drop on the eye like proparacaine or tetracaine, and then carefully remove the contact lens with a sterile Q-tip by gently flushing it out. Removing a contact lens, my go-to is the jeweler's forceps, and they're commonly used in ophthalmology. They're delicate, they don't have teeth at the end, so that decreases the chance of accidentally grasping the conjunctiva, and they're just great to work with. See the contact lens, put that numbing drop in, have the patient look away from where the contact lens is. So that helps to protect the cornea while you're working to remove the contact lens. And also the patient doesn't see what you're doing, and that can be helpful. Some exam techniques that can help find a contact lens is everting the upper lid to see if it's hiding out on the backside, or sweeping the fornices, so the inferior fornix, superior fornix, very gently. Have the patient look away from where you're going to be sweeping. Using a Q-tip, moisten the tip with a numbing drop. And if this is the lower lid, you're going to have the patient look away so you don't say hello to the cornea. And then gently sweep the fornices, and that may help to bring up the contact lens, especially if it's hiding out. Of course, like anything else, know thyself, know what you're comfortable with, and if something is difficult to remove, press pause, get the patient in to see an eye doctor. After you got the contact lens out and patient's happy, you're happy, everyone's relieved, the eye likely at this point is pretty irritated. So you can have the patient use frequent lubrication, over-the-counter preservative-free, artificial tear eye drops, QID plus. So they can use the drops, especially if they're preservative free, as often as they want. So giving them a guideline, QID plus is just the minimum. They can increase as needed. And like I've mentioned in some other videos, they can put the lubricating drops in the refrigerator to cool those drops. It'll feel really nice on the irritated eye. They can also use over-the-counter artificial tear ointment as needed, as well as a warm eye compress, eye mask, like a microwavable eye mask to the closed eyes for about 10 minutes at a time as needed. Make sure when you see that contact lens, throw it out. It's gone. No more. I would tell the patient, you're going to take a contact lens holiday, give the eye some time to breathe. Consider having the patient schedule an outpatient appointment with an eye doctor to rule out any damage and make sure they're good to resume the contact lens wear. If you're in a situation where you can't get the contact lens out, you've tried many things and it's just not working, have the patient follow up with an outpatient eye doctor as soon as possible. As long as there's no urgent pathology, this isn't an emergency. So in this case, you want to keep the eye nice and comfortable by using frequent lubrication, a lot of the preservative-free artificial tear eye drops, having the patient use an ointment, and then get them in with an eye doctor as soon as possible. Let's make today a good day. Click that subscribe button, and I'll see you in the next video.